Welcome to the CITI program's Research Focus series. In this presentation, Maurice from the University of California, Los Angeles is going to discuss gender and sexual minorities, GSM, in human subjects research. Now let me tell you about today's presenter. Moore began contributing to human subjects protection as a teenage activist with ACT UP. Since then, she studied public health at Brown University, supported researchers conducting a variety of human subjects research protocols, then joined the IRB world 15 years ago, first at a pediatric hospital and now for UCLA.
So for our learning objectives today, we'll start with the historical context of legal and medical vulnerabilities for GSM communities. Next, we'll cover current social, cultural vulnerabilities, including the relationship between some members of the GSM communities and their medical care providers. After that, we'll cover resiliency and advocacy by those in GSM communities. And lastly, I'll discuss best practices for investigators and IRBs when designing and reviewing research that involves GSM individuals and human subjects research, of course. In European culture exported to colonies, including the United States, there is a long history of criminalizing gender and sexual minorities. On paper, punitive laws were clearly directed at sexual minority individuals assigned male at birth. However, many signifiers of gay identity, drag, for instance, were indistinguishable, to the blunt weapon of the law, from signifiers of gender minority status. In short, people of transgender experience were likely to be treated as though they were homosexuals. Less obvious was the use of the crime of witchcraft to punish independent women who disobeyed the constraints of the patriarchy. As lesbians and transmasculine individuals are mostly hidden from medieval and Renaissance history, we have only the laws that greatly constrain the freedom of people assigned female birth to suggest the social and legal constraints they may have experienced. So a little bit more about historical context in the 20th century. There were changes, slow, but they did come. The Diagnostic and Statistical Manual removed homosexuality as a psychiatric disorder almost 50 years ago. Yet still there are groups proposing pseudoscientific cures. The position of transgender individuals is even more tenuous, as gender dysphoria is currently still a required psychiatric diagnosis for most insurance coverage of gender-affirming care. These early advocacy and community groups used many strategies to push back against medical and legal discrimination. One interesting chapter of the struggle is the case of One magazine, which was the first pro-gay rights magazine in the United States. Founded in 1953, it soon after was declared obscene under the Comstock laws, and the United States Postal Service refused to deliver it. This started a legal battle which resulted in a victory for One magazine, with a Supreme Court ruling that the USPS cannot refuse to deliver it. This meant that individual gays, even those living in remote rural areas, could find community and know they were not alone. There's an oft-repeated phrase in transgender community circles: no research about us without us. I suggest this phrase applies to all facets of the GSM community as a best practice. The 2011 Institute of Medicine agrees. For research on GSM communities, involvement of individuals from those communities in the research process from design through dissemination is the key to conducting quality research most likely to provide results that meet the need of GSM communities. Non-GSM allies conducting research understand the value of coalition building as a best practice. A non-GSM academic brings to the table an interest and training in research methods. The GSM community members bring perspective on what is most useful to their communities. Both provide valuable contributions to the research enterprise. One advantage of involving community members early and throughout the research process is a much smoother process of conducting the research. GSM communities are used to being targeted and harassed and may look on at outsiders coming into their communities with suspicion. Involving community members at all stages of research can diffuse the possibility of being shut out of communities of interest. I would like to thank you for participating in this webinar. The best thing as a researcher, IRB member, or HRPP staff can do is to be curious about GSM history, vulnerabilities, resiliencies, and how to respectfully include GSM individuals in human subjects research. With that knowledge, you can apply the ethical principles of justice, beneficence, and respect to design, review, and conduct of research with gender and sexual minorities.
Please also be sure to visit the CITI program website to review our content offerings, as we are continually adding new content in various areas of research, ethics, compliance, professional development, and higher education.